kakatapos lang ng hijama. I think cupping therapy. Sarap naman sa pakiramdam. Can you put near to the wound and zoom it?
A brief history of cupping. Cupping therapy, commonly referred to as cupping, has been around for thousands of years. It developed over time from the original use of hollowed-out animal horns, referred to as the horn method, to treat boils and suck the toxins out of snake bites and skin lesions. Horns slowly evolved into bamboo cups, which were eventually replaced by glass. Therapeutic applications evolved with the refinement of the cup itself, and with the cultures that employed cupping as a healthcare technique. The true origin of cupping still remains uncertain to this day. Some consider the Chinese to be responsible for cupping. However, the earliest pictorial records date back to the ancient Egyptians around 1500 BC. Translations of the hieroglyphics in the Ebers Papyrus, the oldest medical textbook, detail the use of cupping for treating fever, pain, vertigo, menstrual imbalances, weakened appetite, and helping to accelerate the healing crisis. From the Egyptians, cupping was introduced to the ancient Greeks, where Hippocrates, the father of modern medicine and notable cupping advocate, viewed cupping as a remedy for almost every type of disease. In fact, other Greek physicians used the strong suction of cupping to restore spinal alignment by reducing dislocated vertebrae from protruding inward. The earliest recorded use of cupping came from the famous alchemist and herbalist Di Hong, who popularized the saying, "Acupuncture and cupping, more than half of the ills cured." The Chinese expanded the utilization of cupping to include its use in surgery to divert blood flow from the surgery site. In the 1950s, after much extensive research, a collaborative effort between the former Soviet Union and China confirmed the clinical efficacy of cupping therapy. Since then, cupping has become a mainstay of government-sponsored hospitals of traditional Chinese medicine. Eventually, cupping spread to ancient cultures in many countries of Europe and even in the Americas. Throughout the 18th century, European and American doctors widely used cupping in their practices to treat common colds and chest infections, often in the form of wet cupping. Wet cupping, also known as artificial leeching and hijama in Muslim societies, is where the practitioner makes tiny incisions in the skin to dredge the blood of poisons out. By the late 1800s, cupping lessened in popularity and was severely criticized and discredited by the newly established scientific model of medicine. The new model defined medicine by making the body transparent, focusing on and treating the inside in preference to the outside. Since cupping was a surface treatment, it was inconsistent with this new medical paradigm, which had shifted away from hands-on manipulative therapies. Decades flew by as cupping therapy gradually became reduced to a mere curiosity of the past, collecting dust on practitioner shelves. In 2004, cupping re-emerged